Good morning, everyone. This video is about the different types of diagnostic evaluation for patients with altered neurological function. Our first topic is about computed tomography, and you can find all this information on page 1929 of our Medsurg book. Computed tomography scanning, or CT scan, is a procedure that uses narrow X-ray beams to scan body parts in successive layers. If you imagine slices from a loaf of bread and looked at the white part of each slice, you basically have an understanding of how a CT scanner works. Images includes the cortex of the brain, the subcortical structures, the ventricles, and even the skull itself. You may have noticed that some parts of the images are lighter or darker than others. Brightness depends on how much X-ray is absorbed by that part of the head. In other words, the more X-ray absorbed, the brighter the tissue will be, and vice versa. Sometimes, during a CT scan, an intravenous iodine contrast agent is used to further differentiate the different tissues and tissue densities in the area of interest. Tumors, lesions, infarctions, hemorrhage, cortical atrophy, and displaced ventricles can be seen in a brain CT. Typically, they first try a CT scan without the contrast dye to see if results provide enough visualization. If that doesn't work, then the IV contrast is used during the second CT scan attempt. There are also different ways to use CT scans. CT angiography, which is the visualization of blood vessels. There is whole body CT scans, which allow cross-sectioning imaging of the spinal cord. CT scan can even be used in conjunction with the MRI to diagnose herniated lumbar discs. As nurses, we need to, there are things we have to do before, during, and after a CT scan procedure. Before the procedure, nurses educate the importance of lying still without talking or moving the face. Nurses can even teach relaxation techniques if the patient has claustrophobia. And if that doesn't work, then sedation can be used if restlessness, agitation, or confusion interferes with the procedure. If contrast will be used, it is important to assess if the patient has allergy to shellfish or iodine allergy. Furthermore, kidney functions must be assessed because the contrast will be cleared through the kidneys. During the procedure, ongoing assessment is required when if sedation is used. If contrast is used, patient status is monitored to see if there is any allergic reaction during and after the procedure and if there are any changes in kidney functions. After, it is important to encourage increased fluid intake to flush out the IV contrast that was used during the procedure.
Magnetic resonance imaging, also known as an MRI, is a diagnostic test which uses a magnetic field to create images of the body. Protons in the body become aligned in this magnetic field, and the protons produce signals, which are then transformed into images. It allows the detection of chemical changes in cells, and it is very useful when diagnosing brain tumors, strokes, and multiple sclerosis. Brain blood flow and metabolism may also be visualized. Some nursing interventions to consider include patient education prior to having the MRI, as well as obtaining a thorough patient history. The patient must be asked if they have any implanted metal objects such as a pacemaker and orthopedic hardware. It is crucial that no metal objects enter the room because the magnetic field created by the MRI will attract anything that is metal. The nurse must also look for medication patches with a foil backing that can potentially cause burns. The scanning process is painless, but the patient will hear loud thumping. The patient may feel anxious about being in a small space, so informing them that they will be able to talk to staff while in the scanner may help, as well as reminding them to use relaxation techniques.
Let's talk about a PET scan. PET stands for positron emission tomography, and it is a nuclear medicine medical imaging technique and most commonly known as a diagnostic test that allows physicians to determine the body's cellular metabolic activity. And on a PET scan, this metabolic activity is indicated through various colors, red being most cellular activity, all the way down to black being no cellular activity. And it is helpful in detecting cancer, brain disorders, and heart disease. The most commonly used tracer that is injected into the patient's body is called fluorodeoxyglucose. This is an example of a PET scan. So a PET scan is important and helps the physician to detect both malignant and benign cancerous tumors, and thus the physician can treat the disease earlier. An amazing part of the PET scan is that it also helps monitor the progress of the treatment. Here is another PET scan. And lastly, the procedure that the patient must go through involves the patient not eating anything for 4 to 6 hours, then being injected with a radioactive sugar. Then they empty their bladder, and lastly, they are put through this PET scan machine. Thank you.
Single photon emission computed tomography, or SPECT, is a three-dimensional imaging technique in which the contrast between normal and abnormal tissue is greatly increased. It is useful in detecting the extent and location of abnormally perfused areas of the brain, allowing, for example, detection, localization, and sizing of stroke, even before it is visible by CT scan. A nurse preparing a patient for SPECT should provide education about what to expect before the test to reduce anxiety and ensure patient cooperation during the test. Pregnancy and breastfeeding are contraindications to SPECT. The nurse may need to accompany and monitor the patient during transport to the nuclear medicine department for the scan. Patients are monitored during and after the procedure for allergic reactions to the radiopharmaceutical agent.
Cerebroangiography is used to determine vessel patency, identify presence of collateral circulation, and provide detail on vascular anomalies that can be used in planning interventions. Cerebroangiograms are performed by threading a catheter through the femoral artery in the groin and up the desired vessel. Alternatively, the carotid artery can also be used. This serves as a route for administering a contrast agent that highlights the cerebral vasculature for X-ray imaging studies. Prior to the test, it is important to monitor the patient's BUN and creatinine levels, as this will tell us if the patient will be able to excrete the contrast agent. The patient is allowed to have clear liquids up until the time of the test, as the patient will be instructed to void prior to the procedure. Once the procedure is complete, it is important to monitor the catheter insertion site for signs of bleeding or hematoma. Peripheral pulses should also be monitored, as this could indicate possible embolism. Also note any signs of allergic reaction, as this could be a result of the contrast agent.
Non-invasive carotid flow studies help us evaluate arterial blood flow and detect arterial stenosis, occlusion, and plaque without being invasive to the client and being cost efficient. A carotid Doppler uses ultrasound to detect narrowing and possible blockages due to plaque buildup or coronary artery disease. Carotid ultrasonography also uses ultrasound, but it also uses imaging on top of that. And it helps us look for clots, atherosclerotic buildup, and other blood flow problems. And ocular plethysmography it helps us estimate the blood pressure of the ophthalmic arteries of the eye. This information is used as an indirect means to assess blood flow in carotid arteries of the neck, which supply the eyes and brain. The detection of impaired blood flow in the ophthalmic arteries indicates carotid artery narrowing, which is a major risk factor for stroke. Ophthalmodynamics gives us an approximate measurement of blood pressure in the central retinal arteries of the eye. As blood pressure is applied to the surface of the eye with a plunger-like device, an ophthalmometrist uses a handheld magnifying instrument, ophthalmoscope, to determine blood flow through the retinal arteries. ODM is used as an indirect means to assess blood pressure in the carotid arteries in the neck, which supply the eyes and the brain. Reduced retinal artery pressure indicates carotid artery narrowing, and the patient is at risk for stroke. Lastly is the transcranial Doppler. The transcranial Doppler is a non-invasive technique that is helpful in assessing vasospasm, a complication following subarachnoid hemorrhaging. Altered cerebral blood flow found in the occlusive vascular disease, other cerebral pathologies, and brain death. So probe is basically a handheld Doppler is going to be put on the temporal and occipital bones, and it's going to record blood velocities of the intracranial vessels. That's all, folks.
A lumbar puncture is a diagnostic test that is performed by inserting a needle into the lumbar subarachnoid space to withdraw cerebral spinal fluid, or CSF. This test is performed to obtain CSF for examination, to measure and reduce CSF pressure, to determine the presence or absence of blood in the CSF, and to administer medication into the spinal canal. Nursing considerations. Ensure that the patient is positioned on one side at the edge of the bed or examining table with back toward the physician, and thighs and legs flexed as much as possible to increase the space between the spinous processes of the vertebra. Ensure that the patient is relaxed, because an anxious patient may have an increased pressure reading. Complications. A post-lumbar puncture headache, ranging from mild to severe, may occur a few hours to several days after the procedure. The headache is caused by CSF leakage at the puncture site. The fluid continues to escape into the tissues by way of the needle track from the spinal canal. As a result of a leak, the supply of CSF in the cranium is depleted to a point at which it is insufficient to maintain proper mechanical stabilization of the brain. Post-lumbar puncture headache may be avoided if a small-gauge needle is used and if the patient remains prone after the procedure. When more than 20 milliliters of CSF is removed, the patient is positioned supine for 6 hours. A post-puncture headache is usually managed by bed rest, analgesic agents, and hydration. Other complications of lumbar puncture include herniation of the intracranial contents, spinal epidural abscess, spinal epidural hematoma, and meningitis are rare but serious complications of lumbar puncture. Other complications include temporary voiding problems, slight elevation of temperature, backache or spasms, and stiffness of the neck. Monitor the patient for complications of lumbar puncture and notify the primary provider if complications occur.